Hello, every, Hello everyone. Welcome to my YouTube channel, Medicine with Umar Channa. Today we will be studying the anatomy of spermatic cord, and we will be digging deeper into it and studying the structures that are the most important structures within the spermatic cord. So first, we'll start with the ductus deferens, or which we also call it as vas deferens, which is a tube, a muscular tube, basically, which transports the sperm from the epididymis. So as you guys can see, epididymis here above the testis. So the ductus deferens, it transports the sperm above the testis into the urethra. So it's responsible for the process of ejaculation in males. So I will label it. This is the tube, ductus deferens, and you can see there is a small artery which is within the ductus deferens. We call it the artery to the ductus deferens. Here you guys can see there's a red artery. After that, we have the epiniform plexus of veins, which is basically a network of veins. They drain the blood from the testis into the testicular vein. So along with it, we also have testicular artery. Both of them you guys can see here. This is the epiniform plexus. Along with it, we have the testicular artery. So we label that as well. Testicular artery plus epiniform plexus. Here there is important clinical part that you need to know for the epiniform plexus. Sometimes there can be widening, or you can say dilation of veins in the testicular veins within the epiniform plexus. We call it varicole. So you guys can see this is the normal side of veins, and these are the veins that have become dilated veins. So these are varicole. This is important clinical correlate that you need to know. Another important thing, we need to know the blood supply of the structures that are within the spermatic cord. So for example, the testicular artery, you need to know that it comes from the branch of abdominal aorta, as you guys can see in this diagram, and it just starts from the branch of renal artery just above. So this is for the testicular artery and the epiniform plexus. The next structure that you need to know is the cremasteric fascia, which is above the testis. Here I'm labeling it. This cremasteric fascia has cremasteric artery and veins. So it is a sheet which has the cremasteric artery and veins, and this yellow part you can see, this is the genitofemoral nerve. So this is a genital branch of the genitofemoral nerve. And the other structure that is not really clearly visible in this diagram, but is very important, we call it the remnant of Processus vaginalis, or when it is closed, we call it the Tunica Vaginalis. Now for a better explanation, you guys can see this diagram here. So you need to imagine that the testis is a small ball, as it seems like, and when it's going down, it brings a little pouch with it, which we call peritoneum, which is a covering, and this pocket of pouch, the whole pocket, we call it the processus vaginalis. So when the processus vaginalis closes around, when it closes around the testis, this we call it the tunica vaginalis, which is the closed part of. And this tunica vaginalis is very important because at times, and we call it hydrocele, and it has the visceral layer which covers the organ, the parietal layer which is the opposite of that visceral layer towards the outside, and it has the anterior border, it has medial and lateral surface, but it does not have the posterior border. Why? Because the posterior border is reserved for the blood vessels. So there is no posterior border in this tunica vaginalis.